నాన్న అంబలన కాదలిచ్చ పొంబల కౌతుపుట్టు పొణాలెన నంజు తాంగల నా కామ నాన్న అంబలన కాదలిచ్చ పొంబల కౌతుపుట్టు పొణాలెన నంజు తాంగల నా దినము ఎంగరయే నెంజుల ఉన్న తాంగరని పకామలే పోనదాలి నొందు సాగరే அடியே உன் கண்ணு தக்காளி சிவப்பு அடியே என் கண்ணு கொஞ்சம் கருப்பு இருந்தும் என் மேல ஏன் இந்த வெறுப்பு உருக்குள்ள கேட்டு பாரு மாமன் தான் நெருப்பு கட்டழகு பொம்பல இதா என்னைக்கும் என்னோட அம்பல.
This is Indonesia, a country with 70,500 islands and more than 255 million citizens. Indonesia is the world's fourth most populous country and is the most populous Muslim majority country. Christians, Hindus and Buddhists are also well represented. Indonesia has a surface of almost 2 million square kilometers. With a population of 150 million, Java is home to almost 60% of the Indonesian population, while it's just the fifth largest island of Indonesia. The large population is due to the fact that Java is the most developed island. Surabaya, also known as the City of Heroes, is the capital of East Java. With a population over 2.9 million citizens, it is the second largest city of Indonesia. Our first stop is at Puskesmas Banyu Urip in Surabaya. This is the primary healthcare center. There is a Puskesmas for approximately every 30,000 citizens. Every day there are between 100 and 200 patients. They come early in the morning, get a number and wait on their turn. It's not possible for them to make an appointment. It doesn't matter how much people come on a day, at the end of the day every patient has been helped. One of the main duties of a Puskesmas is to decrease the health risks of the individuals and of the whole society. To achieve this and other duties, every Puskesmas has programs based on the Millennium Development Goals. One of them is the maternal and child health, including family planning. Both the mother and child get checks every once in a while, the first couple of years after birth. The vaccines for the children are also given at the Puskesmas. The problem that the general practitioners deal with is the time pressure. There are too much patients for the time they've got. This results in a less extensive inquiry, which increases the chance of missing symptoms. This is the Dr. SYTEM Hospital in Surabaya. The Dr. SYTEM Hospital is the biggest hospital in Indonesia with almost 6,000 employees and a total of 1,449 beds. The government of East Java is the owner of this hospital, so it's accessible for all the citizens of Indonesia. We are now at the emergency department of the Dr. SYTEM Hospital. People from whole Eastern Java come to this hospital. The regulation states that this hospital isn't allowed to reject or refer any patients to other hospitals. Overcrowding, with as result a lack of staff for the huge amount of patients, is very common. The most severe cases with a problem in the ABC or D get sent to the resuscitation room. A group of anesthesiologists and nurses ensures the patients are stabilized. On every time of the day, there are 4 anesthesiologists in the resuscitation room who are responsible for a maximum of 6 patients. The busier it is, the smaller the chance of survival. You have a lot of different patients. This is a woman who had just have been resuscitated. In the last 20 days, she had 46 cardiac arrests. Severe dehydration is also a common problem. These are the CT scans of an 11-month-old baby, with tuberculosis in her brain. After the patients have been stabilized, they will be sent to the ICU. This is the ICU. The ICU is made for a maximum of 16 patients, but sometimes there are nearly 30 patients on the ICU. The patients can come from two places. Either they have been stabilized in the resuscitation room or they just had an operation. We are now going to a town called Pacitan, on the border between East and Central Java. There are 5 types of malaria. The 2 most common in Indonesia are Plasmodium vivax and Plasmodium falciparum. This is a blood sample of a patient with Plasmodium vivax. One of the biggest problems in Indonesia is the accessibility of the healthcare. People living in rural areas have to travel for hours to get to the nearest hospital. Because of this, many patients delay their visit to a doctor way too long. We have met 3 patients with malaria. All 3 of them had Plasmodium vivax, the less severe type of malaria. The patients were originally from Sumatra, a less developed island with a high prevalence of malaria. 2 of the patients were already in remission and the older patient on the left has a relapse. Symptoms of malaria vivax are fever every 3 days, icterus, cold chills and vomiting. Sometimes malaria also goes along with an enlarged spleen and liver. We are now on our way to a malaria breeding place. Sweet and still water are the perfect place for the breeding. There are 6 kinds of mosquitoes in this place, but only 2 of them are still carrying malaria. There were a lot of campaigns to eradicate this kind of breeding places in Java, resulting in a huge decrease of the prevalence and incidence of malaria in Java. This is the Sambar Flaga Leprosy Hospital. Leprosy is still a common disease in Indonesia. In fact, Indonesia is in 3rd place on the list of countries with the biggest number of leprosy cases. There's a huge stigma around the disease. Because it is seen as a curse, a diagnosis of leprosy can cut patients off from family, employment and public services. Without treatment, the disease can lead to permanent nerve damage and muscle paralysis. People can lose limbs, which can be eaten away by infections that go unnoticed or untreated due to the lack of sensation in the fingers or toes. The lucky ones who will end up in the hospital will stay there for about 30 years, because they have nowhere else to go. The specialized hospital makes prosthetics and helps the patients to walk again during revalidation lessons. Indonesia, a beautiful and diverse developing country. The healthcare has improved, and a big step has been taken with the implementation of universal health coverage. Despite the lack of financial resources, they always try to make the most out of it. They're on the right track, but there is still much room for improvement.
వందేనే పూ తందేనే ఏ సందేనే